Again, good afternoon, everybody, and welcome to this proposers webinar. We're all very much delighted to have you join us today. My name is Christopher Cambyses. I am the program officer for the San Joaquin Valley Health Fund here at the Center at Sierra Health Foundation. The goal of today's webinar is to make sure that you're all familiar with both the San Joaquin Valley Health Fund as a whole and the funding opportunities that we released last week. And that you understand really what we're looking for so that you're able to submit a competitive proposal should you decide to respond to this funding opportunity. And again, as I mentioned before, this webinar is being recorded and will be posted online alongside these PowerPoint slides as well. Right, so this is our agenda for what we're going to be discussing today. We're just going to be breaking down the two funding opportunities after a brief introduction to who we are for those who may not be familiar with us and our work. Then we'll go over some of the mechanics of how to apply, the application materials, what the online portal looks like, that sort of thing. And then after that, we'll have a couple of different periods where there will be opportunities for you to ask questions related to anything that we discuss. So if I do sort of blow past a particular point, do feel free to bring that back up at any time. So with all that being said, let's launch right into it. So who are we? So the Center at Sierra Health Foundation was launched in 2012. The center is the administrative entity for this project. Our goal is to really bring together people, ideas, and infrastructures to create a positive change in California. The center is the managing entity of the San Joaquin Valley Health Fund as well. And we are dedicated to health and racial equity. It's very much at the center of everything that we do. It was at the core of what we set out to achieve when the center was created and when the San Joaquin Valley Health Fund itself was created. So what do we mean by health and racial equity? These are terms that are used in multiple different forms. So I think it's important for us to really hammer down precisely what we mean when we say health equity. So when we say and racial equity. So when we say health equity, we're talking about achieving the highest possible standard of health for all people. It's about giving a special attention to the needs of those who are at greatest risk of poor health based on social conditions. And by racial equity, we're really talking about a condition that would be achieved if one's racial identity no longer statistically predicted how one fares. And this includes racial justice and includes working to address the root causes of inequities and not just their manifestation. And this takes many different forms, including the elimination of policies, practices, attitudes, cultural messages, different things that reinforce differential outcomes by race or fail to eliminate them. And of course, at its core, it also means addressing structural racism that exists within our society. So the San Joaquin Valley Health Fund is one of the programs of the center. It was launched in 2014, and it's a unique collaboration of 30 funders and more than 160 community organizations. And it was launched with the specific goal to help fuel a movement in the San Joaquin Valley that would advance health and racial equity. So over that time, we've raised more than $14 million and deployed more than 13 million of it over various different funding opportunities that have been focused on advancing the IHHEEL Policy Platform. Now, the IHHEEL Policy Platform, for those who are unfamiliar with it, is the central guiding document of the San Joaquin Valley Health Fund. As a funder collaborative and as a community-driven entity, its focus it is a driving foundational document that directs the work that we do, both as a fund and that our partners, many of you, do in terms of the implementation of the projects that form the basis of much of your work. So IHEEL stands for Immigration, Health, Housing, Education, Environment, Land Use, and Planning. Each one of these letters represents one of the policy priority areas that form the policy platform. These priorities, are set by the community partners. They're articulated in the policy platform that's developed on an annual basis by the community partners. And the idea is that it recognizes the key role of civic participation and community organizing in all the work that we do. So for those who are unfamiliar with the San Joaquin Valley Health Fund and the work that we do, one way of thinking about it is that really there are two aspects to the San Joaquin Valley Health Fund. There's the aspect of it that manifests itself during times like these as a funder, as a mechanism and a vehicle for providing funding to community organizations to advance this policy platform and a range of other causes within the San Joaquin Valley. But it's also a hub. It also exists as a way of convening community partners around shared policy priorities, providing technical assistance and training, and generally uplifting and providing a platform, both in terms of a policy platform, but in terms of the visibility and technical support to various different organizations who are working within one of these policy priority areas. So within the San Joaquin Valley Health Fund itself, there are a wide range of different programs, and one of them that's relevant to this particular funding opportunity is the COVID-19 response cluster. So we launched the COVID-19 response cluster at the onset of the COVID-19 pandemic in late March, early April. The mission of the response cluster has been to ensure that vulnerable families, individuals, and the nonprofits serving them have the essential supplies, such as supplies, food, rent, utilities, and other provisions that are needed. In phase one of the COVID-19 response cluster, we supported 86 community-based organizations through the provision of direct relief assistance to thousands of vulnerable individuals throughout the region. But we're now shifting into phase two of the COVID-19 response cluster. And in phase two, the mission has expanded to support community recovery and resiliency through policy and systems change advocacy with a focus towards addressing the root inequities that contribute to vulnerable populations experiencing severe consequences as a result of various crises. Which is a lot, admittedly, and it's a bit of a large expansion. But one of the ways of viewing this, particularly for those who have worked with us in the past, is that the traditional bread and butter work of the San Joaquin Valley Health Fund has been focused on policy and systems change. It has been focused on advocacy efforts to address root inequities. And phase two of the COVID-19 response cluster is bringing that mission back to the core of the work that we do. In phase one, we pivoted to direct emergency assistance because that's what the need was over the last couple of months in terms of addressing the response element of the pandemic and of this crisis that's faced all of our communities. But now recognizing that that in many ways we are shifting into a different phase of the pandemic, we want to ensure that we're addressing all the different elements, all different aspects that this pandemic has had on our communities. So it's important to point out our funding region for those who may not be familiar with our work and our previous work. So our funding region encompasses these counties that traditionally form the San Joaquin Valley. It's important to keep this in mind as you're thinking of your proposals because your work will need to take place within one of these counties. Your organization may not necessarily have to be based in one of these counties. It's fine if your organization itself is based outside of the San Joaquin Valley. But the work that you propose through this project has to take place and serve communities within this funding region. All right. So a little bit about us. This is our team, our small but very mighty team that works on all of the programming through the San Joaquin Valley Health Fund. Through this process, you are likely to interact with a good number of us, but for the most part, you will have contact with either myself or Lee He, who's the program associate for the San Joaquin Valley Health Fund. Should your proposal be successful, you'll likely interact with others. You're probably familiar with most of us if you've worked with us in the past in some way, shape, or form, but this is our lovely team. All right, so with that in mind, then let's start talking about the funding opportunities themselves. So we have two distinct funding opportunities that are available this time around. So the first one is what we're calling the IHHEEL Advocacy grants. So these are what have traditionally been named the round grants, so the round 4, round 5, round 6 grants that many of you are familiar with. And the focus of these grants are on identifying a specific policy and systems change target that would advance the IHHEEL Policy Platform. And we'll get into a little bit more detail about precisely what that means, but to begin to frame the two distinct opportunities, that is one of them. The second funding opportunity is the COVID-19 Recovery and Resiliency Advocacy. Now, the core work that would be funded under this opportunity is similar to that of the IHHEEL advocacy grants, but this major change to the major element to take note of is that organizations who apply under this funding opportunity must identify a specific COVID-19 related policy and systems change target that will also advance the IHHEEL policy platform. So the simple way of looking at this is that, the IHHEEL advocacy grant opportunity allows you to pursue whatever policy and systems change target you feel is appropriate, as long as it falls within one of the policy priorities underlined in the policy platform. The COVID-19 one has a bit of a narrower focus, though arguably just about anything these days could technically be COVID-19 related, given how pervasive the effects of the pandemic have been in our society. But there is an expectation that the policy or systems change target you identify under the Recovery and Resiliency Advocacy grants is related to COVID-19. And we'll go through a few examples of what this might look like. I'm sure there will be some questions around, what distinguishes one of these from the other. But the important thing to keep in mind at the moment is that there are two distinct funding opportunities, and you will only be able to apply for one of them, not both. All right, so both grants are one-year grants for up to $50,000 each. So we're excited to be able to lift the ceiling for our grant totals from the previous, from round 5 of the IHHEEL advocacy grants. Now we're able to get them up to 50,000 thanks to increase in funding from some of our funding partners, which is tremendous. So multiple one-year grants up to $50,000 each per grant. The grant cycle will run from February the 1st, 2021 through January the 30th, 2022. Current or new partners are eligible to apply. And it's important that you demonstrate experience in policy and systems change advocacy when you craft your project and present your proposal. There are a few requirements that come along with being a grantee of the San Joaquin Valley Health Fund, particularly with these funding opportunities. The first one is that you participate in our monthly policy committee calls. So these are the ongoing meetings that occur on the monthly basis, where the various different members of the policy committee come together to discuss the progress of the advancement of the IHHEEL policy platform for that particular year. they exchange best practices, ideas, coordinate, align services, a wide range of different things. We have guest speakers. But the policy committee calls are important because, as I mentioned earlier, the heart of the San Joaquin Valley Health Fund is ultimately all of you and the work that you're doing and the work that you're doing together, and your engagement with the entity that is the San Joaquin Valley Health Fund on an ongoing basis. We also ask that you attend a minimum of 3 partner convenings, including Equity on the Mall 2021. Due to the ongoing pandemic, these will all likely be held virtually. At this point, we don't anticipate holding either the partner convenings or Equity on the Mall, certainly in person. Though later on in the year, next year, perhaps things might change, but it's for now, assume that these will all be held virtually. And then, of course, we also ask that you share any lessons learned and best practices with the San Joaquin Valley Health Fund Network. And perhaps that's through the policy committee or the individual policy subcommittee calls that also occur throughout the year, or any of the other contexts that we very actively create on an ongoing basis to provide those opportunities for mutual exchange of best practices and information. All right. So on this slide, there are some examples of the types of grants that might be funded. I won't read through all of them because these are pulled directly from the RFP itself. So you can read through in the RFP. There are some specific examples of types of grants that might be funded. We're not here to necessarily say, you have to do this or you have to do that. These are meant to be guides for the type of work that is traditionally funded through these funding opportunities. And we'll also give you some sense of what constitutes a COVID-19 grant and what constitutes just the regular IHHEEL policy platform grants. So in this slide, we have some examples of strategies that could be utilized to advance both the IHHEEL advocacy grant work and the COVID-19 recovery and resiliency grant work. Again, these are pulled directly from the RFP. So I'm not going to necessarily get into any one of them. Your proposal, your project may incorporate many of these, all of these, some of these, but the most successful ones will certainly include a collection of these as part of the work that you propose. It's now important to keep in mind that the goal of your project cannot be a strategy. You need to use whatever combination of these strategies to advance your advocacy. And you need to be able to demonstrate that in the application, how you're using these strategies to advance your advocacy in order to meet or move forward the particular policy or systems change target that you identify, be that a COVID target or a non-COVID related target. Oftentimes, what we've seen in the past is that organizations will base the goal of the project on one of these strategies, when at the end of the day, they're merely a tool for you to reach that goal. All right, so selection criteria. So the center funds nonprofit 501c3 organizations. If you're not a qualifying 501c3 nonprofit, but you do have a fiscal sponsor, then you are eligible to apply. So just keep that in mind. Those are the two sort of categories of organizations that we will be funding during this particular funding opportunity. If you do not fall into one of those two categories, unfortunately, we will not be able to fund you during this funding opportunity. A couple of things to keep in mind in terms of what will constitute a competitive application. We anticipate that we will receive a large number of applications for these funding opportunities. So with that in mind, these are some of the things that may make you competitive. Obviously, a focus on advocacy and policy or systems change is essential. That is very much what these grant opportunities are based on. It's very much what the theory of change that the San Joaquin Valley Health Fund itself is based on, and we would expect to see that. We'll need you to clearly explain why you as the applicant organization is best suited to be successful with the proposed project. One of the things that is mentioned in the RFP, and that I will take some time to mention here as well, is that you are able to apply as a group around a specific project. So multiple organizations can band together if you want to tackle a specific policy or systems change target. But the important thing to keep in mind is that each organization must apply individually and must demonstrate within your application how you would go about implementing the project should, you know, one of the three or four, or two of the three or four, or whatever combination of the organizations that are part of the partnership, you know, are not funded for one reason or another. So do keep that in mind. We've seen very successful examples of collaborations between multiple different organizations around a single issue. But each organization needs to apply on their own merits, and they need to specifically outline what that specific organization is doing that is unique and different from the other organizations in the partnership, but that are all contributing towards the same target or objective. It's extremely important that you articulate the goals, objectives, and projected outcomes. I say that this is particularly important because oftentimes with grants that are not direct services based, but are focused more on, you know, advocacy, policy, and systems change, it can oftentimes be very hard to be particularly articulate about what that specific objective is, you know, what your metrics are, what's success, and what do you expect to be your outcomes from this. So do spend a lot of time being very, very clear about that, because we will need to have a clear understanding of what you envision those predicted outcomes to be. We're definitely, as always, looking for innovative approaches and partnerships as well. The partnerships ties back up to my previous comment, but, you know, particularly in light of COVID-19 and the changes that it's brought to our society and our communities, we'll absolutely be looking for innovative approaches and just different ways of doing business. Need to authentically engage the community, and this is extremely important to us because we trust that our partners that are working with us have those tangible, authentic connections to the communities that we're serving. You know, that to us is really one of the only ways that we can ensure that the work that we're doing is responsive of actual community needs, is responsive of the actual needs of community members, and is ultimately going to be most successful and most effective as well. So if you're coming to the table, if you're putting forward a proposal, we'll absolutely want to see that you have trusted relationships with the community members that you're seeking to serve or continue to serve. You need to include a reasonable project scope and budget. You know, we recognize that $50,000 is not a grand amount of money by any means whatsoever, but we've certainly seen plenty of organizations do quite phenomenal things with that money. Just be realistic with yourselves. Be very reasonable about what can actually truly be achieved with the money that is on offer of this funding opportunity and within the context of all the other things that are occurring right now. And finally, we will be considering the overall geographic and demographic diversity of the region in the selection process. So that's such a general you know, point of awareness for everybody, that these are factors that we consider when we're reviewing applications. So what will we not fund? So these are a list of things that we will absolutely not fund for any reason whatsoever. This is also pulled from the RFP, so if you need referencing, you know, you can also look at it there. But I think this is important, particularly for organizations that may have been funded during phase one of our COVID-19 response cluster, which was based on the provision of direct services. We will not be funding direct services this time around under the COVID-19 response cluster. Phase two is now focused on policy and systems change advocacy work around COVID-19 related issues. So, and then a list of other things. So it's something to keep in mind. We will fund faith-based organizations, but not to do religious activities. You must reach beyond a particular religious group. So the emphasis on that particular point is explicit religious activities. And activities that exclusively benefit the members of sectarian or religious organizations. All right. So I'm going to pause briefly here to answer a few questions. I think I saw a few come through the chat, so I will answer those. Yes, so I'll start answering those and then we'll open it up to anyone else who wants to answer questions. So the first question I have in the chat is the grant available for educational institutions to apply? Generally, no. Most educational it depends on the status of educational institution. Most are not necessarily 501c3s, but do feel free to inquire more directly with us based on your individual status, not knowing specifically what that organization is, that institution is. Another question: if someone was awarded during phase one of the COVID-19 response cluster, are they eligible to apply for phase two? The answer is yes. You are eligible to apply for phase two funding if you received phase one funding. These are two distinct funding opportunities. Just keep in mind that during phase one of the COVID-19 response cluster, the work was focused on direct services, but in phase two, it's focused on advocacy work that is tied to policy and systems change. Another question I received here is, can the proposed project be funded in part by other organizations, or that has to be solely funded by the San Joaquin Valley Health Funds? So yes, it can be funded in part by other organizations. Just demonstrate in your application precisely what the San Joaquin Valley Health Fund would be funding and how that ties in to your larger project. Again, we recognize that $50,000 isn't necessarily a overwhelming amount of money, so it's reasonable that this might be part of something else you have going on. So could you please clarify a bit more about non-lobbying and non-legislative? Does this mean that work toward passing new legislation is totally off the table? This is a big question, one that often is a point of contention. So generally speaking, it's activities that are appropriate under the terms and limitations of being a 501c3 nonprofit. So you can educate and you can provide advocacy on a particular issue, but something that leans towards direct lobbying for passing a specific bill, a specific bit of legislation, that is when it starts to enter into a bit of a gray area. But we're happy to have discussions on precisely if you feel like the activities you might be interested in fall on that on that line, we can certainly have conversations about that. But it is important that the activities you seek to pursue do fall into what is allowable by a 501c3 nonprofit. So can the proposal include deliverables directed at advancing two different planks of the IHHEEL policy platform? Yes, absolutely. We recognize the intersectionality of just about all of the different policy priority areas of the policy platform. It's something that we're actually looking to elevate more directly in this from here on out. So yes, absolutely, it can be directed at advancing more than one of the policy priority areas. Can you provide a definition for how the fund defines policy and systems change? Yes, certainly. In a short form, oh goodness, that's a big question. So predominantly speaking, we're looking at, it goes back to the two activities, you know, that were mentioned earlier. So really, so it's non-lobbying advocacy and education. So the idea is that taking the policy platform that we have, the IHHEEL policy platform, and various different priority areas that we have identified there, you know, identifying a particular target, and that can be something around a specific policy. So if you look at the examples that are listed in the RFP in terms of, you know, potential you know, grants and the projects and how they look, you can sort of see how that's envisioned. You can also refer to, on our website, we have listed all of the previous grantees that have been funded in the projects that they have implemented as well. So you can see more directly, precisely how that works in practice. And I recognize from the earlier question from this one as well that, you know, it's very easy to say, you know, non-lobbying activity, or, you know, non-lobbying advocacy and non-lobbying education, and there are these very big, broad concepts and what's appropriate and what's not appropriate. I would suggest that you review some of those sample grant options, not options. You don't have to pick from one. The sample projects, examples of projects that might be funded, and then examples of what has been funded in the past, to get a better idea of what that looks like in practice. Another question: how many groups will be funded for IHHEEL advocacy grants and for COVID phase 2 grants? So this is a good question. We're still finalizing precisely what the number is going to look like right now, because it's based off of various different funding that is coming in and will be coming in. But for both opportunities, we're looking at roughly around the same number of grantees in each category. So think the 30 grantees range in each category, more or less. But that is not necessarily a hard and fast number right now. It is still a bit in flux, but that's sort of a guide for what we're looking at right now. So, but it depends on various different factors. All right, any other questions before we move on to the next phase about actually applying for these funding opportunities? We'll have another Q&A opportunity here in a few slides. So if there's a question you'd like to ask, you can ask it now, or you can save it for a few minutes from down the road. Can something be systems change without specifically relating to a policy? Yes, it can. I'm trying to think of a particularly good example off the top of my head right now. But yes, it can be, is the short answer there. It's oftentimes easier when it's tied to a specific policy, but theoretically, yes, it can. All right, any other questions, or else I'll move on? All right, moving on then. All right, so in this next section, we'll discuss the application process itself. So this is an online application. As you saw in the RFP, there's the link for the online application. So the RFP, this PowerPoint, a list of all of our partners, everything will be listed on our website, which is shfcenter.org/SJV Health Fund. So please note that there is one separate link for the application itself, and this is what's listed on the website under online application. So if you're new to the sort of Blackboard grants management gifts system, so for example, if you haven't submitted an application in the past, you will need to create an account as a new user. Once you've started an application, it can be saved, but once it's saved, you will no longer be able to use the link that's posted if you want to get to your actual application. Instead, you will receive an email stating that your application has been saved, and it will generate a new link that you can use to access your portal for your in-progress application. So the way you'll know if you've done something incorrect is that if you saved your application, well, you go back in and you're being asked to complete the eligibility quiz again, which we'll talk about in a second, and it's telling you to take the eligibility quiz and restart, then it means you've used the wrong link. So just keep that in mind. Once you've started and saved an application, you'll want to be using that particular link that is sent to you, the new unique link that is sent to you. All right, so before beginning your application, you'll be prompted to complete an online eligibility quiz. So everyone, both former and new applicants, will complete the eligibility quiz. It's just there to help determine if you're eligible for this funding opportunity. It's nothing intense. I think this year it's just down to 2 questions. It's predominantly there to weed out organizations that are either applying for direct services or are not working in the San Joaquin Valley, which are really the 2 big things, the 2 big sort of gates that you need to clear through. But again, please do read the RFP in detail to ensure that that you are eligible before you get into the weeds of actually completing the application. So that's that. All right. Come on. There we go. All right. So we will only review applications that are submitted through our online portal. So this time around, we did not send out a paper application, but just as a general, heads up to everybody, we will not be sending out a paper application. You will be required to submit it on the online portal. This is what it looks like when you first go in to start your application. So a couple of things to keep in mind is be sure that when you are filling out your application and going through each of the tabs that form part of the application, that you're filling out the information thoroughly and correctly as well, particularly if you are an organization that does have a fiscal sponsor. We'll need to ensure that the fiscal sponsor's information is reflected accordingly. The application form itself outlines precisely where all that information needs to go, but just be aware of that when you're completing it so that you complete it correctly. So let's see. So the start date for all, so the start date for grants is February the 1st of 2021. So different grant terms might be considered, but if you do propose a different grant term, then you need to provide a detailed rationale for why that's the case, and we will consider it. As a general rule, we would prefer that you stick to that February 1st deadline starting date. But there is some wiggle room there if there is an extenuating reason why. Just be sure to articulate precisely why that is within the application itself. All right. So on here, this is what it will look like when you receive an email to the account that the email was created, to the email that the account was created under once you save an application. So you can see here, it will generate a new link for you, and this will be the link that you'll be able to click to return to your in-progress application. If for some reason you misplace this email, you can access the link in the RFP, which will take you to the general portal, and at which point you can just log back in and get to this. But this will be the easiest and fastest way of getting directly to your specific application. All right, so the proposed budget. This is what the budget form looks like. The budget form is attached. You can download it directly from the online application itself. So a couple of things to keep in mind. So the different categories of expenses and things are listed on there. You know, break it out. If for whatever reason you're proposing something on your budget that does not fall neatly into one of those categories, just feel free to add it. You know, in the spaces below there under program expense, but do be explicit about what it is, and then on that far right column, identify precisely what it is and why and how it relates to the proposal that you've written and the budget itself. So going back to the question that was asked earlier, so if there are other funding, so if there's other funding that's been committed to this project, we do ask that you list that out so we can have a sense of how our piece of the pie, you know, fits into everything else. Piece of the puzzle pie. I don't know. It's Friday afternoon. We're mixing metaphors now. So because of that, column 1 and 2 may not necessarily add up to the total project budget, but just as you're going through this, try to be as explicit as possible with everything that you're inputting on there. So that total project budget is supposed to reflect not just what you're requesting from us, but also any other funding that might be committed to the project itself. We ask that the total project budget coincide with the grant period to the extent possible. I know when you have other funding sources going on that may not necessarily align perfectly, but do try to keep that in mind. We do ask that you know, your request from us does not exceed $50,000. So even if it's over by $1 or $2, the ceiling is 50,000, and the request should be for a maximum of 50,000. So just keep that in mind as well. Sometimes we get proposals where it's 50,001 or 2, or there's a couple stray pennies or whatnot. The ceiling is 50,000. You can download the budget form from the online portal. It's under the attachments tab that you'll see along the top right of the actual online application itself. There is no separate budget narrative form. Instead, you'll just fill out that last column and give a brief description or list of the purpose of each of the line items. And we don't ask for a budget narrative that breaks everything down. You should be able to outline everything directly onto this budget form itself. All right, let me make sure I didn't miss anything there, but I think we should be good. All right, to the Q&A now. Let's see. All right, any questions about any of that stuff? The actual online application, how to go about the online application, or any questions you may have thought of regarding the first section? Anything at all? Toss it in the chat, please. All right, so just confirming, total budget does not necessarily equal the two funding source columns. So yes, the total budget may not necessarily, the total budget may total budget is for the project entirely. So even if, so you may have the 50,000 from the San Joaquin Valley Health Fund plus some others, but there may be additional money that is factored into that does not necessarily get reflected on the budget. So yes, it may be different. The most important thing that we're looking for is that the request that you're submitting to us for that 50,000 or the number up to 50,000 is accurate and outlined, and then the rest of it is for us to have some context as to what the rest of the picture looks like for your particular organization. All right, let me make sure the flying in hard here. All right, next one. So the RFA says grant term is 1 year, but different grant terms may be considered. So what does that mean? So the grant term is 1 year. In the event that you say, for example, you need to start, instead of starting February 1st, you start March 1st, then your grant, instead of ending on January the 31st of 2022, would end February the 28th of 2022 or whatnot. So it's always going to be 1 year. We'll just shift the term to encompass 1 year on either end. But again, I mention it because it is a possibility that we will theoretically consider, but we would very much prefer that you adhere to that February 1st start date, if at all possible. So can you explain how to access the online application once again? Yes, certainly. So for the very first time you go in to apply, you'll just click on the link that is in the RFA document itself. When you click on that link, you'll be sent to the online portal. If you have never submitted an application with us through our system before, you'll have to create a new account. If you have previously, you'll be able to just log into that same account and apply again. So that's how you'll access that online application. Once you've started an application and you've saved it, then the system will generate a new unique link specifically for you that you will click to go directly to your application in the future. Is there an opportunity for feedback if submitted before the December 4th deadline? Unfortunately, no. As much as we would like to be able to accommodate some of those requests, the workload is just too significant, and we also want to ensure that that we're giving everyone a fair shake, when it comes to the proposal itself. Now, we will talk a little bit about the deadline here and a couple of things to keep in mind related to that as well. All right, let me make sure I didn't miss anything. Any other questions while we're still at this particular spot? Going once, going twice. All right, well, we'll have another opportunity in just a second, so let's keep the train chugging along. All right, here's a couple of these are a checklist of things to keep in mind that you'll need for your application. So again, we encourage you strongly to review the application instructions and the criteria as it's listed out in the RFA, RFP itself. Review it in detail to make sure that the organization qualifies, that the proposal that you're putting forth aligns with what is being asked, and that you're following all the requisite steps. To complete the application in the online portal, you not only need to complete all the application questions that are listed on there, you also need to upload a copy of your 501c3 determination letter. You'll need to upload a copy of your most recent annual financial statement that shows revenue and expenses for a full year. And you'll also need to submit a copy of the project budget that you'll download from the attachments tab in the online application. So a couple things to note. Your financial statement does not need to be an audited financials. If you're a new nonprofit, provide the financials that you have on hand. But for everybody else, we're really looking at a copy of your annual financial statement. So yeah, that's that. All right. Next. So this is the timeline that we're looking at in terms of the grants themselves. So the application deadline is the 4th of December at 5 p.m. That is a hard and fast deadline. We will not entertain applications that are submitted afterwards. You'll actually not even be able to submit an application through the database afterwards, I believe. I think it cuts you off quite firmly. And you'll also not be able, if you submit your application and somehow forget to attach something or whatnot, you will not be able to go back and submit the additional documentation or the item you left out or whatnot. The system generally won't let you even submit your application unless you've uploaded all the required documents. But if for some reason there's an issue and you don't, just keep in mind that after 5 p.m. on the 4th, you will not be able to go back in and make those additions. So we're targeting an award announcement for early February 2021. It's possible that the award announcements may be made in very late January of 2021, but that's sort of the target time period. So the start dates of the projects are listed as February the 1st. We aim to have all funding out to organizations by mid-February at the absolute latest. We're putting mid-February there just to provide the maximum amount of leeway. But obviously, we want to ensure that the funding is in your hands as close to the beginning of the project period as possible. So do keep that in mind. All right. A couple of things to keep in mind for just proposal writing tips. Check for consistency and specificity in the project description, budget narrative, and budget line items. You want to make sure that, well, budget narrative in terms of that column in the budget itself. But just be sure that you're being consistent and specific across all the different elements of your application. Oftentimes we see people mention one thing in the narrative and then something else entirely in the budget, and it doesn't line up, and then we end up having to ask questions. And you certainly don't want us to have to poke and prod or just not know what you mean by any particular item in your proposal. Just like with anything else you write, highly encourage you to have someone who's not involved in the project read your draft application and tell you what they think your project is about. As someone myself who has spent years working in nonprofits and have written my fair share of grant applications, I can't tell you how many times I've done this and handed it to a colleague who's looked at me and said, I have no idea what you're on about here. So, always a helpful thing to think about. And then use the application materials checklist to ensure that all your documents are included in the application package. And make sure that the versions that you upload to the application before you submit are the final versions. So again, we will not be able to go back and replace the budget or anything like that. Once it's up, and that's what we're rolling with. All right. All right, one more Q&A session. Let's go. I've got a few questions here that have piled up. All right, so first question. There's a question in the application asking, specify other funding you have received or have applied for and is pending to respond to the COVID-19 crisis, and explain what this request would enable you to do that other funding does not already support. So if you're applying for the IHEEL funding, do you need to answer this question? I now owe Lee $1. Because she bet me that this question would probably come up. No, we are specifically looking for this question. We're specifically looking at for individuals who are applying for the COVID-19 funding. If you're just applying for the IHEEL advocacy grant, just write NA for that question and move on. But if you are applying for the COVID-19 recovery and resiliency grants, then we do ask you to answer that question. And the reason is that we're getting a sense, we want to get a sense of how different funding opportunities related to COVID-19 in our region are aligning, so that we have a better sense of how we're implementing our programming. There's a wide range of funding out there right now related to COVID-19 for a wide range of different things. So we just want to get a sense of what that funding landscape is really looking like right now in practice with our partners and potential partners. So that's the reason behind that question. If you haven't seen that question yet, you'll see it when you're applying, when you're going through the application. But again, at its core, if you're only applying for the IHEEL, the round 6 IHEEL advocacy grants, then you don't need to respond to that question. Just write NA in the box because you have to write something in that box. But if you are applying for the COVID-19 recovery and resiliency grants, then do please answer that question. So next question, if a fiscally sponsored organization received the COVID-19 relief grant cluster in phase 1, can we apply for the San Joaquin Valley Health Fund Policy Platform opportunity, or do we only qualify for the COVID-19 cluster phase? Good question, but no, you can apply for the IHEEL funding opportunity. You don't have to apply for the COVID-19 recovery and resiliency funding opportunity. You have flexibility to choose the other one. Really, our objective here was, in making this 2 distinct funding opportunities, was to ensure that we provided as comprehensive of a funding opportunity as possible for the largest number of organizations, because we recognize that in many of our partner organizations perhaps do not necessarily work on issues that have a very specific COVID-19 nexus. So we didn't want to necessarily exclude any particular organizations from applying by only having a COVID-19 related funding opportunity. So this ensures that the entire range of policy and systems change, advocacy work in the San Joaquin Valley can be appropriately reflected. So let's see. All right. Any other questions? I think I got everything that's currently in the chat box, but if you have any other questions, please do drop them there in the chat box. And we are now at the top of the hour, so I won't keep everyone too long. We just have another slide or two to get through, and then we'll wrap up. But since this is a proposals webinar, an opportunity to have a bit of a Q&A, I do want to give everyone the opportunity to ask any questions they might have at the moment. All right, well, then we shall move on then. All right. Well, speaking of questions then, so if you do have questions afterwards, or particularly as you're going through the application, then do please feel free to email questions to this email account, sjvhealthfund@shfcenter.org. In the subject line, please write SJVHF RFA question. When you do submit that email. We ask that you submit all questions related to the funding opportunities to this email account. We recognize that many of you have relationships with us and email us on a regular basis, but in order to ensure that we're compiling all of our questions and allowing the opportunity for various members of our team to be able to respond to them as quickly as possible, we're trying to centralize all of the questions. So please do submit your questions to this email address if they are related to these funding opportunities. I also encourage you to check out the additional resources that we have on the website. So there will be these webinar slides and the recorded version of this webinar on there as well. But there's also a wide range of different, reports and, various different documents related to our work in the San Joaquin Valley and various different issues within the San Joaquin Valley that are posted on there that may be helpful to you as you're crafting your proposal. So. And of that, I just want to say thank you again for coming out and for participating in this proposers webinar. We wish you the best of luck in all of your applications, and we look forward to seeing the different proposals that you put together. So I will toss one final opportunity out for anybody if you want to ask any final questions. Otherwise, remember that this webinar will be posted onto the website sometime early next week. So you can always go back and listen to my dulcet tones again if you feel so inclined, or you can send us a question on the email address that we listed. Any final questions? All right. Well, in that case, everybody have a lovely rest of your afternoon, and we'll talk to you soon. Have a good day. All right, I think that's everybody now.
Good job.
Thank you.
Yeah, very, very good. I love the photographs of the staff. That's a nice little touch.
Yeah,
Yeah, that was really awesome. It really like gives it more of a personal, yeah, because this can get so heady. Oh my God.
Yeah, and Lee, I forgot to mention the navigation stuff on the portal.
It's okay. It's on the application, so they'll see it. So
yeah, I mean, it's one of those things that, I mean, honestly, it probably would have been a little bit abstract for them to because when I saw the question about, wait, how do you get to the application again? I'm like, oh God, if we start talking about navigating through the application, we might just lose some people entirely here.
Yeah, no, it's not necessary. It's you know, I think it was nice, but the thing is that they'll get it once they open it. Yeah. So let's see. I think, yeah, but great job. I agree with Diana. Yeah. there were parts of it that I chuckled because I was just like, that's so funny. But like, I don't know. I've never heard of the term of a fair shake.
Oh, yeah.
Or just that last piece about like listening to your tones if we're so inclined. Anyways, yeah, overall, I think you covered everything, you know, and so I really appreciate that. And I think that piece in the beginning that we talked about as far as, you know, kind of laying that groundwork and then really explaining what this IHEEL policy platform is, I thought that you hit it on a, you know, you nailed it. So that's, I think that's really important.
Yeah, no, I mean, thinking back through some of the questions that were being asked, you know, the big question about like, well, what is policy and systems change? It's like, I don't know what policy and systems change is. Nobody knows what policy and systems change is, right? It's like, it's a million different things to a million different people, which is why I made the suggestion of like, you know, go and look at what some other proposals were and what other people have done so you can get an idea of it. Because the reality is that some organizations are a lot better at towing the line about what's allowable and what's not allowable under a 501c3 status than others are, right? I mean, I've seen plenty of organizations that go right up to that line where it's like, wow, that is pretty much political lobbying there. I can't believe you're getting away with that. And they do get away with it, right? It's like, you know, that's what defines a savvy organization over another. And Diana, we're still recording, so we'll need to edit this.
Yes, I'm sorry.
Are we able to cut it off?
Oh yeah.